I've noticed that there are a group of people, especially perimenopausal women, who are facing a lot of hair fall. Also, because of the fact that because their estrogen is reducing as they age and the hormonal fluctuations are in an increasing amount of time and energy in the perimenopausal age, they have seen that the main complaints that we see are the partition which they take, there is a widening of their partition, so the scalp is more visible. The ponytail that they tie, the diameter of the ponytail is getting smaller. They tell that every time I wash my hair, I can see in the drain there's a lump or a clump of my hair which is blocking it. There are few who the spouses or the kids get their females, and they are like, no, my mom had good hair. I have seen her over the past few years. We are seeing her hair is getting scanty. We are seeing her scalp. We see her hair lying all over the house. Every time she sweeps, every time she mops, there's a huge clump of her hair. The patient itself is very concerned, along with them, the family members also. Because at the end of the day, the hair is actually a social, as we are humans are social beings, we want to be presentable, right? So the main factors in that is the skin and the hair. Hair being much more involved than the skin. Skin we can still cover up a little with a makeup and such, but hair, it's a little more consuming for us to keep thinking about our hair, how we are sitting, is our hair being covered, is there any bald spot which is seen, and all such. So so the issue is the scientific reason being because the estrogen reduces in the perimenopausal age, there is a thinning of the individual hair shaft. Along with it, we have testosterone. Women too do have testosterone in their body, but the sensitivity to testosterone increases during that age group. So you would be normal, you would not have any complaints, be it PCOS, non-PCOS clients. But during the perimenopausal age group, their sensitivity to the testosterone increases. And we have noticed that there is a little bit of male pattern baldness seeking into the female's hair type too, which is the crown area, the density is reducing. Like I said, the history would be very similar. The female is feeling very distressed. She doesn't feel beautiful, along with all the other things which are adding up to her stress. Just the loss of hair could also lead to more loss of hair because it is stressful to her. The other thing I've noticed is, being in a city and a little town life, we are overweight, but we are undernutritious. What do you mean by undernutritious? Our body scale and the weight of our body is more on the higher side, but our micronutrients in our body is pretty minimum. So what is the main causes for the hair loss? We know we have been supplementing with all our vitamins, but sometimes unless it is detected that there is a clinical case of vitamin deficiency, overly giving us supplements is not going to make your hair better. So you have to have the proof that your vitamin D, B12 is definitely for vegetarians, that is on the lower side. Vitamin D, although all of us are exposed to the sun nowadays because of the sedentary lifestyle, we are all indoors, still we have noticed that majority of the Indians, because of their repeated checks these days, we are identifying that vitamin D is a deficiency in almost 60-70% of our patients. And we have noticed that that is also one of the trigger for the hair fall. So if your iron is low, your vitamin B, D12, thyroid levels or thyroid imbalances could be hyper or hypo, or any other immunotherapy, or if you're undergoing any treatment, you've had a fever in the last 6 months, anything which has given stress to your body, that would definitely cause a lot of hair fall. So when you're seeing that these micronutrients are replaced in a better way and you're able to catch the culprit and treat it, there is a tendency for your hair fall to come under control. But the issue is, even after correcting this, there will be a little bit of hair fall because we are not correcting the underlying hormonal imbalance which is present. Now that I have seen the patients, we tell them very strictly that if you come to a clinic with a hair fall as your concern, there is no magic rule in which in 2 to 3 months we're going to control your hair fall. You have to keep it in your mind. It takes a minimum of 6 to 8 months for us to even give you a little bit of effect of the medications on your body along with some of the procedures. I've seen some of them have already commented in the comment section that they have tried GFCs and PRPs. Yes, when you are taking those, these are all adjunct therapies. Adjuncts are their additive therapies which help you to improve the hair growth. But there's no hard and fast rule that there's always that 5 to 10% of clients or patients, you do everything right, you nutritious, you give them the supplements, you give them the treatment, put them on the drugs, and still they are not responding. So it depends on patient to patient, but mostly 70-80% do heal their hair fall in a period of 6 to 8 months.